Dr. Brenda Rea, Medical Director of Education for the American College of Lifestyle Medicine. Welcome to this Lifestyle Medicine 101 presentation. Today, we're going to step back and look at a fundamental question in healthcare, not just how we treat disease, but how we address what causes it in the first place. Because when we focus on root causes of chronic disease, we unlock a very different path forward, one that leads to better health outcomes, greater sustainability, and truly restored health. I've spent my career in family, preventive, and lifestyle medicine, and I've been fortunate enough to see firsthand what happens when lifestyle becomes a core part of care. I'm especially passionate about helping clinicians and health professionals integrate evidence-based lifestyle interventions into clinical practice, not as an add-on, but as a primary foundational treatment approach. Because we now have the tools and the evidence to not just manage chronic disease, but to change its trajectory. So let's start with why this matters now. We are facing a chronic disease epidemic at a scale we've never seen before. Most adults are living with at least one chronic condition, and many are managing multiple chronic conditions. At the same time, healthcare costs continue to rise. And despite that investment, outcomes are not improving at a pace that we would actually expect. This is not a failure of individuals or patients. It's a signal that the system itself needs to evolve toward a model that addresses the root causes driving these conditions. Our current system was largely built to handle acute problems, things like infections, injuries, emergencies. But chronic disease is different. It develops over time, often subtly and influenced by daily behaviors and environmental exposures. Yet we often respond with the same model focused on symptom management, adding medications, escalating treatment, revisiting the same underlying issue again and again and again. What's often missing is a consistent, structured approach to addressing root causes. And that's where lifestyle medicine comes in. What is lifestyle medicine? Lifestyle medicine is a medical specialty that uses evidence-based lifestyle interventions as a primary modality to treat, reverse, and prevent chronic disease. That phrase, primary modality, is really, really important. This isn't about occasional advice or general recommendations. It's about prescribing lifestyle interventions with the same level of intention, structure, and follow-through that we apply to medications or procedures. And when implemented effectively, these interventions can change the course of a disease. What makes lifestyle medicine different? It focuses on the root causes and whole person care at the same time. It recognizes that chronic disease doesn't exist in isolation. It reflects patterns across nutrition, movement, sleep, stress, connection, and even environment. It's also prescriptive, meaning these interventions are not optional. They're intentional, structured, and part of a treatment plan. And importantly, lifestyle medicine works alongside medications and procedures, often enhancing their effectiveness, and in some cases, allowing for de-escalation of medications over time. So lifestyle medicine is really built around these 6 key pillars. These include optimal nutrition, physical activity, restorative sleep, stress management, connectedness, and the avoidance of risky substances. Each of these represent a major domain of health behavior, and each is supported by a strong and growing evidence base. Together, they form a comprehensive framework for treating, reversing, and preventing chronic disease. One of the most important principles in lifestyle medicine is that these pillars don't operate independently. They're all interconnected. Sleep affects stress. Stress affects eating patterns. Social connection influences behaviors across the board. That's why lifestyle medicine is integrated and personalized. It also recognizes that health is shaped by social drivers like access, environment, and each person's lived experience. So this is not a one-size-fits-all model. It's adaptive, contextual, and collaborative. Lifestyle medicine is grounded firmly in science. We know that lifestyle factors account for a large proportion of chronic disease risk. And if you look across major clinical practice guidelines like cardiovascular disease, type 2 diabetes, obesity, hypertension, certain cancers, and even depression and others, you'll see lifestyle interventions consistently recommended as first line care. Lifestyle medicine brings this structure, consistency, and implementation to what guidelines already tell us we need to be doing. And it helps translate evidence into everyday clinical practice. When lifestyle becomes the foundation of care, we see meaningful changes across multiple areas. Patients experience improved outcomes and quality of life. Clinicians often report reduced burnout and a renewed sense of purpose in their work. And health systems begin to see better value through improved outcomes with the potential for lower long-term costs. These are not theoretical benefits. They are increasingly documented in real-world implementations. Lifestyle medicine aligns strongly with the quintuple aim of healthcare improvement. It supports better health outcomes, improves the patient experience, reduces cost over time, enhances clinician well-being, and importantly, it advances health equity. By addressing the underlying factors that drive disparity in health, health equity is addressed. This alignment is the key reason lifestyle medicine is gaining traction across healthcare systems. Lifestyle medicine is not just a concept. It's being implemented in real care settings today. It's delivered through team-based models that include physicians, dietitians, nurses, mental health professionals, health coaches, and other healthcare professionals. It's used in primary care, specialty care, group visits, and health systems. And it focuses on helping patients make sustainable, supported changes over time, not just offering advice, but building capacity for long-term health. The American College of Lifestyle Medicine plays a central role in advancing this field. We provide education and training across the continuum from students to practicing clinicians, and we support certification, clinical tools, research, and evidence development. And we work with health systems, partners, and policymakers to scale lifestyle medicine in a way that is rigorous, consistent, and accessible. Our goal is to make lifestyle medicine the foundation of healthcare. The science is clear. The need is urgent. The opportunity is right in front of us. Lifestyle medicine offers a path forward, one that addresses the root cause of disease, restores health, and transforms how we deliver care. If you're interested in learning more or getting involved, I encourage you to visit lifestylemedicine.org. Because ultimately, this is about more than a new approach. It's about establishing a new standard of care. Thank you for being a part of that movement.